Welcome back to Inside South Florida. No doubt you or someone you know has battled in the fight against cancer. Well, now there is some encouraging news. Here's local oncologist Dr. Bobby Green to share the news with you. Dr. Green, it's great to have you on the show. How are you?
Great. Glad to be here. Thanks.
All right, let's start with this. This is from the American Society of Clinical Oncology. They say here in 16 years, cancer will become the leading cause of death in the United States, surpassing heart disease. And they're talking about a dramatic increase in cases, nearly 45% from 2030. Those are some daunting statistics.
Yeah, and while they're absolutely accurate, it's really mostly a function of aging. So cancer is a disease predominantly of people who are older, and the incidence of cancer increases as you get older. So as you look at the aging of the population and the baby boomers who are becoming older now, and that big swath of the population, that predominantly explains the increase in incidence of cancer.
Okay, so it's not like a new sort of form of cancer or a new exposure to something is going to happen.
Right, and in fact, there have been some lifestyle modifications and public health campaigns that have had a positive impact. So the incidence of lung cancer as smoking incidence rates go down has been going down. So yeah, this is almost exclusively a phenomenon of the aging population.
You and I were talking about this earlier. Something else that has to do with this to some degree is you were telling me in some places, some parts of the country, there aren't enough oncologists, right? Some places there are, but some there aren't.
Right. Yeah, and one of the things this report brings out is that if you look at the number of cancer cases and patients who are going to have cancer in the future versus the number of oncologists, those of us who take care of cancer, and the number that they're going to be in the future, there will be a national shortage. Now, in places like we are here in South Florida, at least right now, that's not become a big issue. But in rural areas, you can have patients who can sometimes have to drive 50 or 100 miles just to see an oncologist because there is a shortage. And you can imagine, with cancer as your diagnosis, that's a pretty hard thing to do.
So, all right, so you just sort of explained why these numbers are going to go up, but I'm wondering, are there any other reasons why these numbers might go up? Like, for example, do we still find new cancers? Do those still happen, and how often do they happen?
So not so much that we have found cancers that we didn't know before. I mean, there's always reclassification of cancers. There are some cancers whose incidence rates are going up. So for example, there's a certain type of stomach or esophageal cancer called adenocarcinoma, and the incidence rates of that are going up, and we have some idea why, but it's not entirely clear. There's some types of lymphomas where the incidence rates are going up as well. But predominantly, the increase in incidence rates is going to be an aging phenomenon. You do hear people all the time say, geez, it seems like I know many more people who have cancer. And a lot of that is just a phenomenon that as you get older, your peers are more likely to get cancer as well. So,
what about living in South Florida? The one that I think of is skin cancer. Is there anything else that people who live here are susceptible to?
No, so other than the increased incidence of both what we call non-melanoma skin cancer, so the more common squamous cell and basal cell, as well as melanomas, which are the more deadly form, there isn't anything particular necessarily to South Florida.
Explain to me what the oncologists at Florida Cancer Specialists are doing. You have a partnership with the Mary Crowley Foundation.
Yeah, so I'll tell you a little bit about that and then kind of use that as an example to talk about one of the really promising areas of cancer research. So we've worked with Mary Crowley to do what's called immune therapy, and it's really taking the actual tumor from a patient and using that to harness their own immune system in a way to treat the cancer. And so we've been conducting clinical trials with Mary Crowley, who are really doing some very exciting and groundbreaking stuff. And I think it's been a real value to the patients in our community to really have access to these groundbreaking trials. We've also been working on a lot of targeted trials where we look for specific mutations in cancers and then find targeted treatments for that. But I think one of the really exciting things about the immune therapy is it is an area where we've seen, in some circumstances, really dramatic improvement in outcomes. So for example, there is a type of leukemia called CLL. And there are protocols that are now being developed where in patients with refractory, which means it's not responding to treatment anymore, CLL, taking the patient's own white blood cells and manipulating them and then giving them back to the patient has taken patients who are really on their deathbeds and given them long and durable responses. We've seen immune therapies for patients with diseases like metastatic melanoma that typically don't respond to treatment, and when they do respond, don't respond for a long time, get some of these immune therapies and go into long, durable remissions that we've really never seen before. Now, it's not everyone, so some of these immune therapies may only work in 10 or 15% of the patients. For those patients in whom it works, it's obviously great news. What we need to figure out now is what about the
Right.
other 85% who aren't responding, and what can we do to get them to respond?
But it's a start.
It's a start.
Yeah.
It's really, for some patients, it's really been dramatic. Long way to go, but really just starting to see some really great strides recently.
As we get set to wrap this up, what are some things that people can do health-wise? Can you prevent cancer from happening, and if so, what can you do?
Yeah, so, and this is one of those areas where it sounds like obvious stuff, but it's probably worth saying again. So one of the biggest killers, despite the decreasing incidence that I talked about before, is lung cancer. And probably about 80% of lung cancers are caused by smoking. So it's still a disease with an enormous amount of societal costs and individual costs. So not smoking and avoidance of secondhand smoke is incredibly important in reducing cancer incidence. Diet has a huge impact. There's lots of cancers that there are lots of dietary risk factors for, and so the obvious stuff, healthy diet, low fat, lots of fruits and vegetables is important.
And some of it's luck, right? The luck of the draw.
Yeah, and it's something I tell a lot of patients a lot of times is, because you'll have people who come in and say, I did everything right, and how did I still get this? And a lot of times we don't have a great explanation.
Yeah. If people want to ask you questions, if they want to reach you, how can they find you?
So we're Florida Cancer Specialists in West Palm Beach. We're actually a practice that's throughout the state of Florida, the largest private oncology practice actually in the country. Locally here, we're in West Palm Beach Gardens, Wellington, and Lake Worth, Atlantis, 561-366-4100 or flcancer.com.
You were great. Thanks so much for coming on. And,
thanks.
And we'll have you again.
Yeah, it's been great being here. Thanks for having me.
You got it.
Thanks.
Thank you, Dr. Green. That'll do it for our show today. Hope you enjoyed it. If you have any ideas as to what we should cover, you can follow us on Twitter at WSFL. You can always get us on Facebook at SFLCW and Inside South Florida. And of course, you can catch us every weekday from 6 to 8 a.m. for our daily morning show, Eye Opener. Hope you have a great rest of the day, a great rest of the weekend, and we'll see you again soon right here on SFL TV.